Now, health. I have been saying since I started doing this show in July of last year, I said it on the first show, that at some point, if we're going to deal with an NHS backlog in England and Wales of 6.1 million people, we're going to have to start thinking more constructively about how we use the private sector. Well, I'm pleased to say, in some ways, that the Health Secretary, Sajid Javid, had this to say today.
It starts with more choice at the front door, including more active discussions between professionals and patients. But that right to choose can't just end at the front door. Today I'm announcing a better offer to long waiters. We will move to a model where long waiters will be offered a right to choose, proactively contacted to discuss an offer of alternative provisions. That could be the trust next door. It could be a trust that's further away, and if it is, your transport costs, accommodations, other incidental costs will be covered. It could be the independent sector. This is something the very best systems are already doing, but I want it to become standard. And I know it won't be easy, and that we must begin by making this offer to the very longest waiters. So by the end of December, people who are at risk of waiting 78 weeks or more will be contacted first.
Well, the very longest waiters that were referred to there by Sajid Javid are the nearly 250,000 people who've been waiting well over a year in many cases. And I guess that's what this policy is aimed at. On the face of it, I think it makes a whole load of sense. But let's go to somebody who knows far more about the way this works than me. I'm joined by a friend of the programme, Roy Lilley, former NHS Trust Chairman and health commentator. Roy, welcome back to the show. We've talked about this, you and I, in the past. Is Sajid Javid now taking this problem, at least to some extent, in the right direction?
Well, good evening, Nigel. Yeah, well, yes, he is. But I mean, it's not quite as simple as he says. First of all, already patients have the right to go to a private hospital under the NHS Constitution. So he's not announced anything new. They can do that now. What he's saying, the new bit is they are going to proactively go to people and say, listen, you've been waiting a long time. Do you want to go somewhere else? Well, that's fair enough. I mean, there are issues about the fact that people on waiting lists are generally older people. Some of the operations are quite complicated. Post-operative, there's an issue about getting them home and all that. So it's not quite that easy. And there's the private sector thing. I mean, look, no one's got any problems with the private sector. I mean, it's staffed by NHS people anyway. But the issue is this: at the moment, the private sector are having a Klondike because there are long waiting lists. People are doing what we call self-pay, or families are syndicating the costs for granny's new hip, so they're paying, and they're chock-a-block, at premium rates. If they work for the NHS, they are only allowed to be paid at tariff. Now, tariff is the kind of price that the NHS pays to itself, so it can't pay more, can't pay a premium to the private sector. So the private sector is saying, well, listen, thanks very much. I mean, we were happy to help you during COVID because no one could go to hospital. But as it is, we're chock-a-block with our own hips and we're getting 17,000 quid for a hip, and you're only going to pay us £8,000. So, I don't really see this is going to be the big solution.
No, well, what you say makes absolute perfect sense. I was just trying to be optimistic, but you clearly kicked that into touch fairly rapidly. Roy, what on earth are we going to do? No, that's all right. I mean, I believe you. What are we going to do? This waiting list is getting bigger and bigger and bigger. What the hell are we going to do?
Nigel, it's horrendous. It's partly workforce. We don't have the workforce. We went into COVID with huge workforce problems that were the legacy of 10 years of flatline funding after the world banking crisis. We didn't train enough people. We went into COVID. COVID kind of disguised all the staffing problems because everybody did everything. Now we're coming out of that. We just simply don't have the people. We don't have the capacity. I mean, the private sector is fine. I mean, most of their capacity is 60% of it is centered in London. So that doesn't really help anywhere else. And there are issues as well. A lot of them, not all of them, but a lot of them don't have ITU. So in 2019, for example, I think it was just under 600 people were operated on in the private sector and had to be transferred by ambulance to a hospital because they ran into problems. What are we going to do? It's a long haul, Nigel. I mean, if I had a solution, I'd tell you. I mean, there was a time I was involved a few years ago with sending cardiac patients to Belgium and to Germany. We can't do that because Belgium and Germany have got their own problems post-COVID. So this is going to be a long haul. I think two things we should do. One, I think some hospitals should be accident and emergency trauma hospitals and take care of all the trauma. You can do that on a semi-regional basis. And all the others, I'd turn them into effectively hip factories or knee factories and let them do 3 operating sessions a day running into the late of night, for the staff who are willing to do it, and just try and crack people through. And that's really all you can do. One of the problems with doing it in your local hospital is you can sometimes get your operating list completely screwed up by the fact there's a smack on the motorway and you've got to come in and do trauma patients. So if we could just kind of get the factory principle working, we could do that. So, I mean, that's really the only thing I can think of. And, the NHS aren't stupid. They'll do that anyway.
Okay. All right. No, well, that's practical stuff. Roy, as ever, thank you for joining us here on the programme.
Thanks.